Hello, good afternoon, tribe. I am so thankful you have joined us. Nyssa is here with me, and I am delighted to have her. If you don't already know, she is the host, a host of the Q Word podcast, an emergency room nurse podcast, but it's not just for emergency room nurses. It is so much fun. I'm not an emergency room nurse and I love it. So she is a flight nurse with a passion for guiding and teaching our next generation of nurses. She loves learning and has a passion for family presence when running the smoothest code you've ever seen. I'm excited to have Nyssa with us, and thanks for giving us your time. Welcome.
Thanks for having me. Thank you. Happy to be here.
Yeah, so is there anything else in the introduction you'd like to add?
Well, I will say that it's my goal to run the smoothest code blue you've ever seen. I don't know that I've ever done it yet. That's a goal, though. But yeah, family presence at the bedside is one of my huge passions, and I love new nurses and new grads. So I'm happy to be here.
Yes, her and I were just talking off the air, and how much we appreciate all these new students and new grads. Man, we need you, and we're so thankful that you are coming into our profession in such a trying time. So, Nyssa, as an icebreaker, I love for my guests to share their funniest nursing stories. So let's hear it.
So I just recently shared it in the group, actually. Okay. I can recap it, or I can give you my second funniest. So one of my funniest favorite nursing stories is when I went to renew my ACLS, and we went to the classroom, and it's far away from patient care. It's over in an education room, and we're getting ready to run the mega code just in the ACLS classroom. And they have someone who's acting as the scribe, and we're writing on the whiteboard. Mm-hmm. And I'm getting ready to write. I'm going to be the scribe, and the dry erase markers in the classroom are garbage, and they won't hardly write on there at all. And so an ICU nurse is there who also is renewing her ACLS. Do you remember this?
Yes.
As an ICU nurse. So if you are a new grad or a student, you might not know that there is a little bit of a rivalry between ER and ICU. I like for it to be a friendly rivalry. And so anyway, I'm complaining that the dry erase marker is just totally garbage and dried out. And the ICU nurse goes to her backpack and opens it up and pulls out a brand new pack of dry erase markers and says, "I remember from 2 years ago that they were terrible. Here, I brought," and I was so stunned that this was the most ICU nurse thing I had ever seen, that she was so organized and had this amazing memory and planned and prepared. And I was barely together that day. Couldn't even remember, did it start at 10 or 10:15? It just showed just a beautiful illustration of how different our brains work. And I will never forget that moment. I was like, wow, we are so different.
I love it, though. And it takes every single one of us and our strengths and our weaknesses coming together to form the profession of nursing. It's so incredible. And yeah, I floated down to the ER as a tech one day from my standard ICU type position. And I was like, never can do this. I just knew that ER was not going to be my bag. The PICU is where I had to find my home. But anyway, today we are talking about great first impressions equals great first positions, and really honing in on the new grad interview, which I'm super excited about. And I know this is the perfect season to be doing this. All of these grads just graduating with very little to no bedside experience during nursing school. We get it. You're stressed. And hopefully we can clarify some things for you today and give you some pointers to help you relax and succeed in your first interview. So when did you decide you had a passion for working with new students and new grads?
Yeah, so in my first position in the ER, so several years in, I became the nurse educator, and part of that role was to participate in interviews. Okay. And so we interviewed people for internships, we interviewed people for new grads for residency positions, and then we interviewed people who were just transitioning into the role from other facilities or other departments. And so I saw a lot of really good interviews. I saw stellar interviews, and I saw a lot of pitfalls. And so that's what kind of led to this topic. And then as as the educator, it was part of my job to really work closely with the new grads and with the externs to help them transition seamlessly into the ER. And any critical care position is a really difficult place for new grads. It can be done, absolutely can be done, but it is difficult. And so working really closely with them really was a lot of fun. It's a lot of fun.
It is. So when do you recommend students start applying for their very first nursing position as they get into that senior year of nursing school? When do you suggest that they start submitting some applications?
So if you are graduating in May, if this is your last semester right now, then you should start looking for positions in February. So they will start posting new grad positions or residency positions in February, and then expect to interview around March or so. It'll vary a little bit by institution. So around your second month of whatever your final semester will be.
Okay.
So that'll be next month. You'll start looking around and then interviewing the following month.
So Verona asked a really applicable question. She said, all of these jobs say current license required as a prerequisite. What do I do?
Right. So it'll say new grad position or residency position. So the assumption is obviously that you don't have your license yet, but that you will be testing for NCLEX when you get your authorization to test. One important thing to mention is that the assumption is made that when you get your authorization to test, that you will test in a timely manner, that you'll be testing within a week or two of getting your authorization to test. So one thing I wanted to mention is that if you have plans to delay your test, so let's say you have your wedding planned, or let's say you're going to have a baby, and so you're going to delay testing for 2 or 3 months, you need to mention that in your interview. And so then they will make accommodations for that, or they will say, you need to interview in the next group. But when you accept or are offered a new grad position or a residency position, the understanding is that you will be testing and be successful within a few weeks of your authorization to test. So that means then if you are not successful in your first round of NCLEX, it's not the end of the world, but you will then probably be put into the next cohort when you are successful at NCLEX. So it's another point. You need to notify the place that offered you the position if you are unsuccessful. And there are plans for that, and there are ways to address that as well, because it's not an uncommon occurrence.
So when I graduated in 2005, I was a nurse graduate. And so I went into my unit and worked as a nurse graduate with similar expectations that along those lines I would be testing and succeeding somewhere in whatever time frame they gave me. And so I did that and I succeeded, but some of my cohort that started with me didn't succeed. And so they ended up working as a unit secretary or as a tech until they successfully tested. Is that something that's not common anymore?
No, that's the way most institutions will handle it. It just depends. It depends on how many positions they have. It depends on how many candidates they have. So if someone who's unsuccessful is holding the position of a strong candidate that could be in that slot, that may be a factor. So it just means that you need to be in constant contact with your facility.
Yeah.
To work out that kind of those scenarios. But again, it happens frequently, and so there are stipulations for those sorts of things.
Okay. And so if there aren't any current, new grad or residency type programs in your area, what do you suggest they do?
So then you're just going to apply for a regular RN position, and then you'll just make notes in your application that you would be a new grad, or that you will be testing approximately June or July, something like that.
Perfect. I love that recommendation. So any recommendations on finding a residency program? Verona's looking in Texas or even New Mexico area. She's willing to broaden her scope, which I think is amazing and necessary right at the moment.
Yeah, I don't know that market, but I know some people who do, Kevin McFarland. So I would say when you're searching for them, that you are specifically going to be looking for new grad residencies. And I would go to the larger facilities. Those are the ones that usually offer the residencies, or the hospitals that have multiple facilities in their, like
Network,
larger, help me out.
network maybe?
What's that? Yes, like a hospital network that has multiple facilities. Those are the ones that are going to have residency programs because they're larger. So they
Right.
have those sorts of resources.
And also university-based
Yes.
institutions, specifically speaking to the UNM area in New Mexico. University of New Mexico has a big residency program, and I don't know what its current standing is because I'm no longer in that area, but definitely encourage Rona to look at University of New Mexico if you're willing to go to
Right.
Mexico.
So teaching facilities, level ones, large cities, magnet facilities. Those are all ones that would probably be your best bets for residencies.
Brittany asked, what are the pros and cons of residency?
It's a really good question. So I highly recommend residency. The pro is, so let's talk about what a residency is. Basically, what you're going to do is you're going to spend several weeks, even into months. You're going to be going to class. You're going to be doing modules on the computer, often at home. You're going to be probably taking tests. You might even be doing a capstone project, a group project, a process improvement, or a quality project. It sounds a lot like another semester of nursing school, and it's going to feel a lot like another semester of nursing school. There's several big important differences. The first one is you're not paying tuition. The second one is you're collecting a paycheck now. And the third one, and the most important one, of course, is that in nursing school, you're learning a broad amount of knowledge about a whole bunch of things.
Yeah.
Now you have chosen your specialty. So let's say you're pediatric ICU. You are learning all of the things that are specific to becoming a pediatric ICU nurse, or you've chosen ER. Now you're learning what's specific to becoming a really good emergency nurse. The con that I can think of is that it's going to feel like another semester of nursing school. You spent 2 or more years ready to get out there and be a nurse, and you're going to be sitting in a classroom again. You're going to be sitting in front of a computer again, and you just want to go out there and save lives and do cool stuff. You will spend time in the unit for sure with your preceptor, and you will touch patients, and you will do that part. But it's going to feel like, come on already, let me get out there. You're also going to want to do overtime. You're going to want to get a paycheck, and you're going to want to pay off some of that student debt. There's plenty of time for that, I promise. So you might feel some frustration in that vein. I hear that or heard that a lot. But really try to take advantage of this time where you're learning your specialty. You only get one new grad orientation. Slow it down, take advantage of every minute of it. Lots of times I would have nurses come to me and say, I'm ready. Can I just get off early? Can I get off 2 weeks early? Can you just cut me loose? And it's mainly because they wanted to start making overtime. Sometimes it was, and sometimes they really were ready and we felt comfortable. But in general, what I would say is just slow it down a minute. Take every minute that you can, learn every single thing that you can from your preceptor, because you really never in your nursing career get this opportunity again. You will precept again, you might orient again if you change departments or change specialties, but you're never going to get another new grad orientation. So take advantage of it. So I think those are the main pros and just a few very little cons.
Yeah, and different residency programs are designed differently. There are some that have a track. So you're going to be in the mother and baby track, and you're not sure if you're going to do L&D or OB outpatient or L&D recovery or different things postpartum. You're going to have maybe 3 or 4 units that you get to sample. And then when a position is open and it's your turn to be let loose, then you apply for that specific unit. That's one way residencies are organized. And then another way residencies are organized are more along the lines of what Nyssa was describing, all of that really didactic heavy project baby steps. They're focusing specifically on ER, and that's your specialty now. You know exactly where you're headed, and they're giving you all these tools and resources to help you be successful and hit the ground running when you're off orientation. I highly, highly suggest residency programs, but learn what your facility offers and in what way they're structured to.
Yeah, that's a good point. In fact, the residency that I did was like you described it, was I wasn't sure what I wanted to do. So I did a critical care nurse residency that
Yes.
was adult ICUs, including the ER.
Mhm.
And ultimately I decided that I wanted to do ER, but the experience that I had in the adult ICUs made me a better ER nurse.
Yes.
And so it doesn't matter the knowledge that you get throughout that time, you take it with you for the rest of your nursing career. It's never wasted information or knowledge or experience.
And quite honestly, it's really valuable because you get perspective from different healthcare providers on different units, and it really makes you empathetic to what the ICUs are doing or what the ER is doing. It really helps you, like you said, it gives you more valuable knowledge. And I think in the long term, it really makes you a better nurse.
Yeah, and the other advantage that I had when I finished that residency is because I had experience there and because I had precepted there, I had all the codes and the computer experience and so forth. They let me work my overtime in the ICUs. So it made me a more versatile nurse. And man, I just really loved it.
Yeah, I definitely recommend. I don't really see many reasons why you wouldn't go for that if that's an opportunity. But if you're in a smaller facility or you're in a different area of the country that doesn't likely have residency programs, don't let that deter you. It's okay. Take that new grad position and soak it up and make the best out of it. You don't have to have a residency. Don't feel like you do. So many healthcare employers tend to utilize behavioral-based interview questions. It allows us to get a sense of how the interviewee performs and behaves under various circumstances that they might verbally give you in your interview. And I tend to answer these with real-life stories or examples, but what are your favorite, I guess, suggestions or pointers for those to successfully interview, especially those that don't have any bedside experience and didn't get much nursing school bedside clinical? What pointers and tips do you have for them?
Yeah, so some of our favorite questions that we used to ask in the interviews were things kind of like you said, scenario based, like, but it's things that you could still answer even if they weren't patient based. So some of the questions we used to ask would be like, tell me about your favorite day in nursing. Tell me about your worst day in nursing.
Mhm.
Tell me about a mistake you made in nursing. Tell me about, we would ask about your first patient death. We left them open-ended enough where nurses could answer them any way possible. So I would definitely recommend that you come in with some experience-based. So it may not be patient experience because of what's happening right now
Yeah.
with virtual precepting and virtual sim lab type um, um, clinicals.
Hmm.
So, and I do think that interviewers have to realize that this is a different time.
Yeah.
This is a different type of nursing school. So that is expected when you go to interviews in 2021.
Yeah, for sure.
So yeah, so I think that coming in with experience about maybe how you handled a test or how you handled a project or how you maximized your experience in these most unique times would be my recommendation.
I agree. And even using that sim lab situation, maybe there was a really challenging case that everyone was kind of struggling with, and maybe you finally had that critical thinking moment that got you guys past that. Use those, make notes of those throughout nursing school because you can reference those later, even if you don't get that bedside experience. And also use patient experience. Maybe your mom was a patient or your grandma was a patient. You can utilize those sorts of experiences too.
Right. Or something happened in the community. You were at a restaurant and
Mhm.
somebody syncopized or someone choked, or you still had a worse day in nursing. It might have not been patient related, but what did you learn from it? You
Yeah.
still had a best day in nursing. Still might not have been patient related, but what was it? Maybe you did really, really well on a test. What did you do differently that time?
Mhm.
What did you learn that you could apply at the bedside?
Yeah, completely agree. So Kevin asked, how do you address the dreaded "what are your weaknesses" question?
Yeah, so we did love to ask this question, and it comes straight from HR. And it's this question that it's sort of a gaming kind of question where you're supposed to tell a strength, but frame it like a weakness, like I just care too much, or I just work too hard. And you would be surprised at how many people come into an interview and don't know to do that.
Yeah.
And so there is a mulligan for nursing. And so what I would say is I would kind of do that. I would take something that really is a strength in many ways and say, and talk about it in that aspect. But nursing, there is kind of a unique way that you can also frame it. And that is every nurse has a weakness, a thing that they don't handle well. We still have to do it, but we don't necessarily like to do it. And so for me, it is rotten and broken teeth. It's my weakness. What's yours, Chelsea? Do you have one?
I don't like suctioning trachs at all.
Right.
I really dislike suctioning trachs.
So this is your mulligan. You can actually take this in a very literal way and say, my weakness is rotten and broken teeth. I will do them. I will take care of them. I just don't like it. And then you can turn it into a discussion about how what you have learned is that nursing is very much collaborative and a team sport. And so, Chelsea, I will agree that when we work together, I'm going to do all of your trach suctioning if you will do all of the teeth brushing and mouth care on my intubated patients. And we will collaborate and we will work together as a team because that's what we do in nursing. And then that's how you can handle that question.
Yes, agreed completely. When talking about resolving conflict, what are the interviewees actually looking for?
Right. Resolving conflict. So this can be a tricky one. This can be a landmine. So what I would encourage you to do is talk about communication on this one. So 90% of all interpersonal conflict, whether it's in nursing, whether it's in your family life, whether it's in a conflict with a stranger, is miscommunication related. And we know that a lot of mistakes and injuries that are patient related are also about communication. And so that's the angle that I would take on this one. I would talk about a miscommunication. I would talk about closed loop communication, which is a principle that we talk about in nursing, and how we can avoid this mistake by repeating and verifying and validating. And I would talk about when you had this miscommunication, what did you learn and how are you going to prevent it in the future? So anytime you're asked about a mistake or a conflict, I would pick one that had minimal injury or damage, and I would focus on the lesson that you learned and how to prevent it in the future.
Absolutely. And always go back to how you're going to prevent it. Make sure you end with that. Now, when I take a verbal order, I always repeat and then repeat again. This is what you said. This is what I heard. Is this what you said? Just as an example, I absolutely 100% on all of that.
Yeah. So, and then when I went and did the thing, I went back to Dr. So-and-so and said, I just did da, 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 da. Is that what you wanted? Is there anything else? Yeah.
Yeah, absolutely. Agreed. Olivia asked, when asked, what are your goals? Is it best to discuss moving up and additional schooling and those sorts of long-term goals that you have, or is that not a good thing to be talking about in your interview?
Yeah, this is a really great question,
great
Olivia.
Question.
Yes. So, and what I would say to that is industry-wide, nurses are going back to school. This is not a secret. This is not something that interviewers or managers will be surprised by. So if you have plans to go on to get an F&P or a CRNA school or whatever, no interviewer is going to be surprised to hear that. So my preference was transparency. I want to know that in 3 years, when you apply to school, you're going to probably ask to go down to part-time so that you can get clinicals. I want to know what kind of time frame I'm looking at with you. So we appreciated transparency. Again, industry-wide, this is happening, so this is not a surprise to anyone. I would caution you in saying something like, I want to go into management and be where you're sitting in 5 years. I want your job. that's a different thing. So even if that's true, I would be cautious how if you do have goals of leadership and management, that's amazing and perfect and fine. I would just be careful how you present that to the current manager leader.
Yeah, absolutely.
But going back for masters, everyone is doing that. It's industry wide. That's what people are doing. So I would encourage you to be transparent about that. And if they can't support you in doing that now, then you probably don't want to be in that department anyway.
Sure. And I think also being careful about the time frame that you set for yourself. So if you say, I want to get 1 year experience here in your ER and go back to school. Careful there. I mean, even if that's your mental goal, like, okay, in about a year, I'm going to start applying, that might change. So just be careful not to shoot yourself in the foot by putting such a short-term commitment in your interviewee's eyes. You're committing to them for only a year, and maybe that's not a good fit, right? So definitely leave your goal open-ended. Like, I'm really looking forward to getting my foot in the door and getting experience, and down the road I would like to X, Y, and Z, whatever your plans are.
Right.
And then in terms of
Go ahead.
In terms of leadership, I think if your goal is leadership, letting them know that you really look to them and hope to gain as much experience and skills from them, as leadership is something that you have your eyes on and you're really excited to learn from them throughout your time on that unit, I think is a great way to put that. And I agree with Lisa. Don't let them know you want their position. That's different.
Again, it's something I've heard in interviews, which is why I mention it.
Yeah.
The question we used to ask is, where do you see yourself in 5 years? And so it wasn't uncommon for people to say, I do plan on going back to school. But certainly you don't have to say, in a year from now, I'm going to apply. And in 2 years from now, I'm going to drop down to, it's no one's business what your timeline is.
Sure.
But certainly, it's fine to be transparent and say, I do plan on pursuing a master's degree at some point in the near future or in the future. And a really great answer to the 5-year question. Sometimes people would be embarrassed by this answer, but it's, to me, the best answer is they would say, in 5 years, I want to be a really amazing emergency nurse, or I want to be a really good emergency nurse. And they would think that that's not a great answer, or it's just, it's the best answer of them all.
Yeah. And I feel like that adds a piece of humility to it as well, because you're letting your interviewee know that you're open to learning and growing over that 5-year span, that you don't feel like you got it all figured out, right? Because when I'm accepting a new team member onto my team, I hope that they're going to be willing to grow and learn and continue to add on to that knowledge for 5, 10, forever, really. We're always constantly learning. But anyway, absolutely. I really like that answer. And I don't think I would ever answer that myself as a new grad. I don't think I would have thought to answer that. And I think that's a great suggestion for sure. This one's interesting. When asked the question, talk about a time when you were in a leadership role. Many who don't have healthcare experience freeze and they're not quite sure how to respond. How would you encourage the use of everyday experiences to draw on the leadership aspects of nursing?
Yeah, that's a good question. So we often would look at people's resume, and I think this was even mentioned on the Facebook page, but people who have retail experience, people who have restaurant experience, any type of service industry experience, mothers, are you kidding me? That is leadership experience. That is multitasking experience. That is putting out all kinds of fires all the time. You probably participated in a group project in nursing school. Were you the team lead in that? That's a leadership experience. Maybe you do something in a community, something that you were involved in. Now, probably in the last 2 years of nursing school, you probably had to set aside your hobbies. I understand that. But maybe in your church group or in a civic group, did you participate in something in that way? So it's okay to think outside the box. And even just something like, I was the team lead in a group project that we did in nursing school. I consider that leadership, and let's talk about it.
Yeah.
And you can use that. But people who were wait staff, people who were retail, they can speak to the customer service aspect of nursing, and we consider that really invaluable experience. for nursing. So we definitely will look at that, and we will talk about it in your interview. And if your interviewer doesn't, you can bring it up and talk about the things that you learned in those roles that will help you in your nursing. You definitely fielded complaints. You definitely multitasked. You definitely dealt with a boss and a customer, and sometimes their goals were opposite, and you had to try to be the intermediary. Those are all really valuable skills that will come into play in nursing.
Yeah, and I see a lot of second, third career nurses coming in, and I am so thankful you are coming. We need you. You bring so much value and experience and perspective to our career that please don't ever second guess whether making a career change into nursing. And some people put an age on. Oh, I'm 30 something and I'm just getting into nursing school. I'm 40 something and I'm just doing this. You are bringing so much value to our profession, and don't second guess everything that you have to offer. And thank you. Thank you to all of you who have background in retail and all the things that Nyssa just mentioned. I mean, you're valuable to us and our patients. You bring so much.
Yes. Some of the second career, like older folks that were coming into nursing, we would see pharmacy techs. They come with a lot of knowledge that's really important. Teachers,
Yeah.
wow. And IT people, a lot of IT people coming into nursing, and they have a lot of knowledge that cross transfers over.
Yes. Moral of the story, bring it on. We need you.
Yeah.
Okay, so Frida asked, how do you answer the question, name a time when you were asked to practice outside your scope of practice, and how did you handle it?
Yes. So there was a lot of discussion on the Facebook page about this one. I would never use this in an interview personally. And the discussion talked about how this feels a lot like a trap. And that's the reason why I wouldn't use it. So I would be very careful about this one.
Mm-hmm.
And the twin question was, how would you handle something that's not in your job description? That's a very different question. That's like, are you above mopping the floor? Are you above giving a bed bath? That's what they're trying to get at on that question.
Yeah.
Something that's outside of your scope, that's a very different question. So I would be very careful with the way that you answer this one.
Mm-hmm.
And maybe discuss the time that you were asked to do something outside of your scope and you recognized it, and how you handled that sort of interpersonal tricky situation and did not work outside of your scope. Or how you partnered and with someone and said, that's not in my scope, but I'm happy to help you if you show me, how can I make time so that you can do it? Or I would be very careful with that question.
Yeah.
And I would be very careful with that practice. So there will be times in your practice where, a PA or a physician says, hey, do you want to stitch up this wound? I'll show you how to do it. Or, hey, do you want to do this incision and drainage? And you think, man, that'd be really cool. Don't do it. Don't do it.
Yes, that is super tempting.
Yes.
So these questions kind of go hand in hand, so I'm just going to ask them together. What are some common questions that you would advise people not to answer in a certain way? And then the other side of that was some bloopers of first-time interviewers. So I feel like those go hand in hand. What are some questions you commonly hear, some answers, and you're like, probably wouldn't have gone there? Do you have anything specific?
Yeah, so we would always start off with in our interviews by saying, so why did you choose nursing? Why of all the careers did you choose nursing? And that's a very personal question. There's really no wrong answer, but an answer that I did not love to hear was if someone said, well, I got into healthcare because it's really the only industry that's never going to, like if you gave me a financial reason that's why you got in, that's going to be a really hard one, and you're probably not going to love nursing. If you got into it because you have a passion for it, or because you saw how your grandmother was treated by nurses and you wanted to be a part of that, or because you were a patient yourself, that's a really common thing, or because ever since you were little, that's the thing that those are the stories that I heard very, very frequently. But when I heard, well, the healthcare industry, even in recessions, is the only industry that continues to grow, that's the one that was worrisome to me. I mean, it's your personal reason, so it's not wrong, but it's a red flag for me. The next question that I would ask is, why did you choose emergency nursing? That's going to be, whatever your specialty is. Why of all the specialties did you choose ours? And that would be, there's probably not a wrong answer for that one either. But if you said, well, I'm an adrenaline junkie, then I need you to know that you're going to be doing a lot of twisted ankles and a lot of sore throats. It's not traumas all day long. Wow. So as long as you understand that, and you know that trauma is a very small percentage of what we do, then welcome aboard. And then the third question that we would start with would be, of all the emergency rooms in the area, why are you choosing ours? And on that question, my expectation is that you've done a little bit of homework about our emergency department, or whatever department it is that you're interviewing for, that you've looked and you can tell me the difference between ours and all of the other ones in the community. So do you know that we're a level 1 trauma center? And do you know what that means? Why is that a big deal? Do you know that we're a magnet facility and what that means? Do you know that we're a teaching hospital and what that means? So if this is really where you want to work and this is really your passion, then you should be able to speak to those things and do a little bit of homework and tell me why this emergency room is the one that you really want to work at. Or is it you want to work at any ER, and ours is just, one of the many you have applied for. So those are, if you can't really answer those well, or you don't have a good reason, or you haven't looked into those very thoroughly, those would be some cause some hesitations. As we talked about before, we liked to ask about some of your days in nursing, like worst days, best days, patient experiences. So I would have some patient experiences prepared that you can talk about. Let's see, if you worked in that hospital for clinicals, or you precepted there, or you externed there, I would definitely mention some of the employees that taught you some things. Another question that we like to ask is, what's the best thing that you learned in nursing school? Like, what's the one thing that was like oh man, that was good stuff. I loved that nugget of wisdom. So bring that and be prepared with that. I would have several little things prepared, anecdotes or pieces of information that you can sort of plug in to whatever the question is. You know what I mean? You can sort of change them based on what the question is. It was a red flag when we would ask a question and we would just get crickets. Somebody would just give us a blank stare. That was kind of a red flag. And then the final question that we would ask is, we would ask, what do you like to do outside of nursing? And we would be asking you sort of like, what are your hobbies? What are your pastimes? And it sounds like a really innocent, like getting to know you question. And it is. We do want to get to know you. And a lot of nursing students would say, I've just done nursing school for 2 years. All my hobbies are gone. I don't have any anymore. But what we're really looking for is, we want to know that when this job gets really bad, when you see the really bad and the really ugly of this job, that you have something that you can turn to, that you have a hobby or a talent or a support system, a church family or a group of friends or your fur babies, like we were talking about earlier, that you have something or some multiple things that you can turn to when you have some really bad days in nursing. So while it looks like a nice little, hey, tell us about yourself, what do you like to do? It's a really important question, and very good managers and educators will make note of it, so that when we also see that you've had that bad day, we can use that and say, maybe you need to go to the gym today. Maybe you need to go and play some music today. Maybe you need to, whatever, fill in the blank, because we remembered it from your interview, because we made note. It's a very important question to me in the interview.
That's amazing. And
finally, we're going to say, what questions do you have for us? And that's also a really important question. And how you answer that is important. So you should have some questions pre-prepared to ask for us. Things that you should not ask us. Don't ask us, how much are you going to pay me? This is a job. It's very important for you to know how much you're going to get paid. But that's a question for HR. That's, unless you're at a very small facility and they're all the same person, that's not for the department manager and the educator in this committee. It's for HR. Another question not to ask is, so did I get the job? When do I start? That's not for that. It's cute, but no, don't do that.
Yeah.
Some good questions to ask would be, what will my orientation look like? How will you choose my preceptor? How will I know during my orientation if I'm on track? What's the feedback mechanism that I will know I'm doing good, doing average, I'm falling behind? Right now, I would ask, what's your PPE situation? I would ask, how much COVID are you seeing? I would ask, what's your patient-nurse ratio? What's your attrition rate? I would ask all of those kinds of things. It might even be appropriate to ask, what's the culture of your department like? Like, what's the vibe? What's the personality of your department? That might be something you would want to ask. So I would definitely have some questions prepared for the opportunity to ask them back.
Mm-hmm. For sure. All great input and suggestions. I'm going to piggyback on the bloopers discussion. I was part of the peer interview committee, and if you ever get an opportunity to be on that committee, you should do it. It's really eye-opening and it's really empowering because you get to help be part of the selection process. But we were asking questions about what drew them to our facility. And this particular candidate started talking very clearly about our sister facility, or our competitor, I guess you would call it. I don't know. I think that's all silly. But anyway, another hospital down the way. And it was very, very apparent that they were not talking about our institution. And so something to make sure, even if you have multiple applications out there, be very diligent in your homework prior to walking into the facility that you're going to interview at, and make sure you've got all your ducks in a row.
Yes. I've had the same experience where they brought in their cover letter that said, I'm applying for, and it was the opposite facility.
Oh, yeah.
Seeking a position at, and it was the wrong hospital. We were like, that's a party foul.
Yeah, right. Something that I think is super important is also bringing questions. And I don't feel like there's anything, against saying, what does your unit do for team building? And this question, when it was asked, it was always kind of tricky. They would ask something about turnover, like, what's your nurse turnover like? Although that's very important, be careful in the way in which you word it. I like to word it on the opposite. What's your longevity of staffing like? Because then they get to talk about how long a lot of their employees have been there versus their turnover. So instead of making it a negative, you're allowing them to make it a positive, which I think is really important.
And not only that, if your turnover is because people are going to nurse practitioner school, or they're going to CRNA school, or they're going to flight,
right,
it's not necessarily a bad thing. If they're leaving because they hate their job, that's a different reason for attrition. So that's something to explore as well. Why are they leaving?
And that's hard to get into in your interview. But it's definitely important, but I don't know that that's super relevant in your initial interview, and that might be a bit of a turnoff. What do you think about that?
Yeah, maybe for a new grad. I don't know.
Yeah. But
it's probably also a number that you could find on the web. It's probably reported, so you could probably find it.
But unfortunately, those leave a lot to be desired, because it's not like it talks about, this number of people who left went on to a master's program or went on to flight or whatever that situation actually was. In the PICU I worked at, we had a period of time where people were going back to a master's program right and left. We could not keep staff. But then there was a period of time that in that same institution where people were leaving because they just weren't a good fit. And that was part on us as the hiring committee. We weren't doing a good job figuring out who was actually going to be a good fit for our institution. So it's so multifactorial. It's not that it was a miserable place to work. It was multifaceted, I guess. Let's talk about if there's no other questions coming through, there's not, okay. If there is any, feel free to interrupt, get them in there. We'll get it answered before Nyssa goes. But a lot of nurses have a side hustle, and I happen to love your side hustle. Why don't you tell us a little bit about your podcast?
Okay, so my best friend and I have a podcast called the Q Word Podcast. And the Q word refers to that one word we don't say when we're having a nice, manageable shift. I'm very superstitious. And it is an emergency nursing podcast, although, like you said, we have a lot of nursing students that listen. We have a lot of medics that listen. We have a lot of ICU nurses that listen, even though we tease them sometimes. And we talk about, it's a lot about the culture of emergency nursing. We do talk about clinical stuff sometimes. And we talk about tips, and we talk about trends, and we talk about taboos. So
I absolutely love one of the podcasts that you did, and I actually did a write-up on it in the group, just kind of discussing all the thoughts that were going through my head as I was listening to it. But the Imposter podcast, which I think is amazing for anybody to listen to, but specifically new grads, you worked hard to get where you're at. Have faith that you're in the exact position that you need to be in, and just soak it all in. And if you don't know what I'm talking about, listen to the podcast and you will have all of your questions answered. It was really good. It was The Imposter. What was the actual title, Nyssa? Do you remember? Something about
I think it's just called Imposter Syndrome.
Okay, perfect. Perfect. Well, I love your podcast, and I'm so thankful that I ran across it and that you're an active member of the Tri-Barian group. So what would you say you're looking forward to in your career?
COVID for being over. Can't wait for COVID to be over. In my career, so I have a nurse bucket list. And because I'm a flight nurse, it is specifically a flight nurse bucket list.
Okay.
And so I have some items on my nurse bucket list. So for instance, I wanted to do flights across state lines. I have now done that many times, so that's been crossed off. I wanted to do a flight where I was the first one on the scene before ground EMS even got there. I've done that one time. That was amazing. So there's really one thing that's left on my flight nurse bucket list, and that is to catch a baby. On occasion, it happens in the ER where a lady doesn't quite make it up to L&D, and an ER nurse gets to catch a baby. Most ER nurses want nothing to do with that. Most medics want nothing to do with that. I just really want to catch a baby. I think I might be an L&D nurse disguised in an ER nurse's body, but I just want to do it the one time. And I don't want to do a 24-weeker. I want like an 8-pounder, and I want to like Lion King it up for everyone to see. And I just really look forward to the day when that happens sometime. Currently, my like short-term thing is I'm signed up for a course where I'm going to learn to do ultrasound guided IVs.
Oh yeah.
I know a lot of people are already doing them, and I'm a little bit behind on that. So I'm looking forward to that, learning that skill. And
You have access to ultrasound in flight?
No, this would be for I also have a hospital side hustle.
Okay.
So
awesome. Kevin asks, what's on your nursing never again list?
Ooh, that's a good one. Nursing never again. Let's see. What would I never do again? I will never put a combative patient in the aircraft again without 2 IVs or more.
That's a good one.
Especially in the summer in Georgia, because when they perspire, those IVs slide right out. I will never do that again.
That's a pretty good one. And that's Kevin McFarland, by the way. Kevin, I don't know if you knew or heard, but Nyssa gave you a shout out about residency programs in your area. So if you have any answer to that question, you can let us know. All right, let's see. In closing, if anyone listening today takes away one thing from our discussion, what would it be?
Okay, so this is about nursing in general for new nurses in 2021. And it's not really something we've touched on, and it doesn't really have to do with your interview, but this is what I want to leave you with. If you get into your first nursing position and it's not a good fit, or you get into your first job and you're perfectly miserable, please don't abandon nursing. One of the great things about the nursing profession is there's so many lateral options. So many. There's a fit for you somewhere in nursing. So don't abandon the profession altogether. And if you are in Tribe RN, there are many, many of us, and I can name all kinds of names, Sarah and Gina and Kevin and Chelsea and Nyssa, that would be happy to help you explore some options until we find a good fit for you. We need you. Sometimes the first fit is not the best. Sometimes the second fit is not the best, but there's a fit and a place for you. So please don't abandon the profession altogether. We'll find something for you. This is a really hard time to be a nurse. It's an even harder time to be a new grad. So stay the course and let us help you if you need it.
Yes.
So that's what I would leave you with.
I love that. There is a place for every single one of you listening. So if you need us, reach out to us. We want to help you find your place. All right, guys, in closing today, I want to say thank you for being here. Thank you for being in the tribe. Thank you for empowering each other, learning together, laughing together. We need the laughs, bring them on, and supporting one another. Never stop learning. Thank you for your time today. See ya.